So the Phase II AERN trial is an investigator-sponsored trial that is run in Germany and other European countries, and it's enrolling patients with relapsed Hodgkin lymphoma who failed anti-PD-1 treatment. So these patients progressed on anti-PD-1 antibodies, and then they are enrolled in the trial. And in the trial they receive the anti-PD-1 antibody Nivolumab, and then local radiotherapy at a dose of 20 gray and 2 gray fractions to a single lesion. And we measure the irradiated lesion, but we measure all other lesions throughout the course of treatment to see whether the local radiotherapy has a distant effect and basically induces an abscopal effect. The abscopal effect is something that has been described in many retrospective series and even case reports, postulating that local radiotherapy induces a systemic immune response and therefore is able to induce responses far away from the lesion that was irradiated. And we want to basically, in a proof of concept study, follow up on this concept and for the first time prospectively investigate whether this really is a thing and whether this works to the benefit of our patients. And so far we have enrolled 9 patients in stage 1 of this trial, and the interim analysis was conducted as pre-planned, and the data monitoring committee recommended that we share this data because it's very exciting. Across these 9 patients we observed abscopal responses in 56% of cases and also partial responses in 56% of cases. And when we look at the waterfall plot of these lesions, we see that not only the irradiated lesion goes down, but many other lesions which are far away from the irradiation site actually decreased in size, and some of them even turned PET negative, hinting at basically a systemic effect of local radiotherapy and an anti-PD-1 antibody administered systemically. So that's something that's very promising, and therefore this trial is continuing enrollment in stage 2 at, as I said, many European trial sites, and patients are actively going on this trial, and we are very eager to learn whether this preliminary efficacy data holds up, and we are also eager to understand the mechanism involved by doing the correlative studies on tumor tissue and also blood that we are collecting in this trial.